All right, so we're going to move on to the psychotherapy approaches to treatment of psychological disorders. In these treatments, various psychological techniques are used to help a person overcome psychological disorders and difficulties and resolve problems they may be experiencing and living their daily life successfully. So, there are four major approaches within the psychotherapy treatments. We have the psychodynamic approach, the behavioral approach, the cognitive approach, and the humanistic approach. So, first, we're going to cover the psychodynamic approach. And this approach uses psychoanalysis to release hidden thoughts and feelings from the unconscious mind to reduce one's unconscious power of controlling their behavior. So, think back again to Freud, who focused on the unconscious. The main assumption here from this approach is that symptoms of a psychological disorder reflect conflicts that are happening within the unconscious. And these conflicts are causing anxiety in the individual. So, the overall goal with this treatment approach is to gain insight or have the person come to understand these conflicts that they're experiencing unconsciously. This treatment aims to help clients understand and explore these unconscious conflicts so they can live out their day to day lives more effectively. There are a couple of techniques that are used by these therapists or psychoanalysts for treatment of psychological disorders. So, the first is called free association. And in this technique, the client is encouraged to speak freely and say whatever it is that comes to mind. So, speak anything and everything that they are thinking, and this in turn reveals their unconscious processes. The therapist then tries to recognize and label these connections, so connecting to what the individual is saying and what is going on in their unconscious. The second technique is the dream interpretation. This is where the patient's dreams are examined. Again, the goal here is to find clues within the dream of the unconscious conflicts and problems that the individual is experiencing. So the therapist attempts to find the underlying meaning of the description of the dreams. And third, the third technique is referred to as transference. So, this is where the individual transfers their feelings of love, anger, sadness, any emotion or feeling that may have been directed at someone else. So, maybe the patient's parents or family, maybe authority figures in their life, etc. They're going to transfer these feelings or emotions to the therapist. And then from that, the therapist can derive, again, the unconscious conflicts that are causing these emotions or feelings. So these techniques were originally proposed by Freud, um, and he proposed they would go on for a long period of time, and they were often very expensive. So he recommended that people be treated for an hour, anywhere from 4 to 5 days a week, sometimes for several years. More modern forms of these techniques often recommend that individuals attend therapy for around 3 months, give or take, depending on the individual's condition. And the therapist often takes a more active rather than passive approach. So the therapy sessions are actually directed by the therapist. They ask very specific questions and they guide the patient where they want them to go in terms of talking about their experiences, with less emphasis on the patient's past history and childhood and more emphasis on current relationships, experiences, complaints, and so on. It is difficult to determine whether this technique is successful, as they still largely focus on the unconscious, the ID, the ego in these techniques. And the question is, do these hypothetical constructs even exist? And if they don't, then we probably shouldn't center treatment around them. All right, so moving on to the behavioral approach. These treatments involve the use of the basic processes involved in learning. So, techniques used such as reinforcement, which is used to increase desirable or appropriate behaviors, or the use of extinction or punishment to reduce um, undesirable or inappropriate behaviors. So, as we talked about last week, from a behavioral perspective, abnormal behaviors are learned in the same way as normal behavior. So, these can be learned through classical conditioning, social learning, or operant conditioning. From this perspective, the focus is not on what people are thinking or their unconscious or emotions, but rather the focus is on understanding how these behaviors originated and how they can be changed. Various forms of classical conditioning are used in the behavioral approach. So, first, we have something called systematic desensitization. This involves exposure to the stimulus that produces anxiety or fear in the individual. So, this exposure is then paired simultaneously with deep relaxation techniques to remove the anxiety response to the given stimulus. So, whatever gives the individual anxiety, they're directly exposed to that while at the same time they're engaging in deep relaxation techniques. And I'll show you an example of that in just a moment. We also have something called aversive conditioning. So, this is used to reduce the frequency of undesirable behavior. And basically, we pair this undesirable behavior with an aversive or unpleasant stimulus. So, think about an individual engaging in an undesirable behavior and an aversive stimulus is applied. So typically this isn't done anymore, but you just for the example, they're shocked, right? So they engage in the behavior you don't want to see, and then they receive a light shock. And finally, we have implosive therapy. This is also known as flooding. So this is used with patients who have severe anxiety. And in this treatment, they're suddenly confronted with the stimulus that produces fear or anxiety. So they're presented fully with the stimulus, not gradually. In systematic desensitization, as you'll see in the example I'm about to show you, the individual is exposed to the stimulus that produces fear or anxiety gradually. But in plosive therapy, there is no gradual buildup. The stimulus is just presented. So that's the difference between the two. Okay, so here's an example of systematic desensitization for a phobia of spiders. Hopefully, no one is too afraid of spiders, and these pictures don't freak you out. Feel free to skip them if they're bothering you at all. But so this is an example for arachnophobia or phobia of spiders. So first, we want the individual to achieve a state of relaxation. So we're going to walk them through and teach them various behaviors to engage in so that they can be relaxed. So things like deep breathing, relaxing their muscles and their tension, maybe closing their eyes, focusing on something that doesn't cause anxiety. So picturing that in their mind, things like that. And then a fear hierarchy is constructed. So, this is where the individual makes a list of various levels of anxiety that they have associated with different aspects of the stimulus they're afraid of. So, in this case, it would be spiders. And then we pair that relaxation with the items in the hierarchy. So, here's what that looks like. A patient is in a relaxed state and they're told to envision, or maybe they're even shown a picture of a spider far away on a wall. And they stay at this level until they can think of or look at that picture of a spider on the wall and still be relaxed. So we'll present that stimulus and then make sure that they're still engaging in their relaxation techniques until they are fully relaxed. Then we move the picture closer to them. So maybe they're holding the picture and they stay here until they can hold the picture of the spider, or we might just be asking them to envision holding the picture of the spider. And we stay in this step until they can do this and still remain relaxed. And they move like this through each step of the hierarchy. not moving on until they can maintain the state of relaxation, until finally they're holding the spider and they're still able to stay relaxed. So there's no more fear or anxiety induced by that stimulus. Operant conditioning can also be used, and typically here we use reinforcement. So, learning from the environment, your behavior produces something positive, and as a result, that behavior increases in the future. That is the process of reinforcement. And it has been shown to be quite successful for a wide variety of applications. So this is an older study, but it's an interesting one. And there are a few things we can take from it. But in this study, this was done at a hospital ward in the 70s with schizophrenic patients. So they took their four most inactive schizophrenic patients, so they really would not engage in any activities at all, and they gave them a task. So the behavior that was required of them was stripping copper wire from electrical coils. An odd behavior. We'll talk about that in a second, but that was the behavior they had to engage in. And then they would receive the reinforcer for this behavior, which was inactivity, which basically means if they engaged in this behavior, they were allowed to sit and do nothing for, I think, 90 seconds. So this was a reinforcer for these individuals. They wanted to sit and do nothing. And what they saw was an increase in activity levels from shaping and reinforcement for two of the patients. For the other two who didn't receive reinforcement, of course, they didn't see any behavior change. And again, like I said, they used doing nothing as the reinforcer. Now, in the clinical field, not only are reinforcers specific to the individual, so what they want, right? But also the behavior as well is usually individualized. So we make sure it's a behavior the individual actually wants to engage in. If we want to increase that behavior, stripping copper wires may not have been a great activity for these individuals. It may not be something they would have liked. Um, but if it had been something they were interested in, they might have even seen a greater increase in activity levels. They might have seen that behavior increase even more if it was something that the individuals preferred. So, just something to keep in mind. But this is a good example of demonstrating how, when you use reinforcement, you can increase behavior. So the behavioral approach does work quite well, and it has been shown to work for individuals with anxiety, depression, phobias, certainly compulsions, so OCD behaviors, impulsive behaviors, and replacing maladaptive behaviors, things like drug or substance abuse. And it is also used a lot in gambling behaviors. And an additional benefit to this approach that is different from the other techniques is that these techniques are so simple that they can be used by the individual easily to change their own behavior. So once they learn the techniques, they're no longer dependent on a therapist to change their behavior. They don't have to go to therapy for months or years on end. Once they know the techniques and the strategies, they can implement them on their own. So that is a unique benefit to the behavioral approach.